Well, you know, when you schedule a live video for two guys that are still in a clinical practice, you get what you get, right?
That's it. I mean, I'll give you an example. I had a lady come in this morning complaining of headaches, a new patient, and then after doing her history, she had a car crash 25 years ago that put a lordosis that was supposed to be in her neck into about a 12-degree kyphosis, headaches, neck pain. Then she got bilateral knee pain. She's got balance problems, agraphesthesia from her feet, knees, right hand, left hand is fine. So anyway, it takes a little bit of time to get through that process, and you know, you got to be able to help these people when they come in.
Right. So, when you get into this line of work, it's a lot more than just how many can we stuff in there, because a lot of these, like the best example is you go in there to test someone's reflexes, and they don't even know that they have 10 reflexes. They're so used to getting just their knees whacked on. And then when someone else starts to look at all the other reflexes that are there, people are a little surprised.
I will give you an example, and I'm glad you brought that up. You know, we do our reflexes, and I told her, I said, we have 10 reflexes, and the only one that was working any response that was a +2 was actually her right patellar reflex, C5, C6, C7. It was just like hitting a 2x4 in the upper extremities. Left knee, again, no reflex, and Achilles, no response. So, and again, it's, and basically the only doctor she had seen was her medical doctor to put her on rheumatoid medication. And I'm like, okay, well, now we know you have an autoimmune disorder, so there's some other tests that we have to run to help improve the quality of your life and to optimize this outcome. So, but again, thank you for having me on today, man. I know you're busy, I'm busy, and it's just, you know, we're here to serve our patients, and we're here to serve the healthcare community. So again, thank you for having me on today.
Yeah, it's all about the people. As I said before, you know, in the text messages that we've sent back and forth, I want to do this weekly because people need to hear these stories about these patients. At some point we can grab a patient or two and throw them on here.
Let me move out of the way so everybody can see my new book,
which I put a link in the comment section to this book. I'm not a digital book guy. I want that. I want the paper copy. So I just ordered mine on Amazon this morning.
Thank you. But it's actually, my publisher just sent me an email and said it's been the number one position for over a week for pain management, even though, you know, that's what people come in for, is health problems and pain management. But, you know, your goal, my goal is to optimize the recovery of this human being that's sitting in front of us. And like you said last time, you know, pain is a brain-based issue, so chronic pain. So, and you have to address the whole neurometabolic aspect of that to get this human being to get their recovery to the maximum level. And I think this is what my book is about, is untangling all of those webs of dysfunction with a chronic health problem. So.
Yep, 100%. So what we want to do, though, is we want to talk, just share stories about different patients, and I'll start.
Okay.
I want to tell you about Clarence. Clarence came into us 2015, 2016, somewhere in that ballpark, and he had neuropathy. Those people who, and emphasis on the word had, neuropathy. The people that are watching this who have neuropathy, they know exactly what I'm talking about. For those people who don't, neuropathy is, by definition, it's a stupid diagnosis because it just basically means nerve pain. So the medical community will say, hey, you've got neuropathy, which is their fancy way of saying you have nerve pain. Here's gabapentin, which is an anti-seizure medication. Go take this. Go away, because managed care won't pay me long enough to sit down here and tell you actually what the problem is. So here's your medication. See you later. Long story short, there's basically 3 different types of neuropathy. There are 3 different causes. There's number 1, which is diabetes, diabetic neuropathy, which is a blood sugar issue. Number 2, chemo-induced or chemical-induced neuropathy. And then number 3 is this word idiopathic neuropathy, which basically means we are idiots. We don't know what's wrong with you. But I have changed the name of number 3 to autoimmune-induced neuropathy. All 3 of those causes are actually inflammatory problems that decrease the blood flow to the nerves. And Clarence did not accept the answer of, I've got neuropathy, there's nothing that can be done. So back in 2015-16, the details are basically this. We cleaned up his diet. We cleaned up his gut. We stimulated those nerves, that nerve pathway very specifically, and his nerve pain improved. Okay, so fast forward to just 2 weeks ago, we still have an aging individual, right? We still have a man in the 70s, and he's still eating clean, but we're still going to age even when we get clean, when you eat clean. But you can certainly slow that process down. But so now we're into his mid to late 70s, and he's helping a widow paint her house. So he's doing repetitive motions with his shoulder, and lo and behold, his shoulder has an issue. So he goes to the doctor, says you need a replacement, and the doctor says no, I don't think. And Clarence says no, I don't think so. So my phone rings, and Clarence comes in. I'm kind of looking at him, going, okay, well, I'm all about disruptors. I'm all about things that just can disrupt the way that your own health is going, and that's why I'm so big into regenerative medicine. So I'm sitting across the table from Clarence going, all right, this guy's going to need to have injections on both stem cell exosome injections on both shoulders. This is going to be absolutely life-changing for me, for him and for me. Because let's face it, Andy, this is how we make a living, right? So I'm thinking we're going to do these injections. Everything's going to be honky-dory. But in the meantime, let's just try and do what's called shockwave and laser therapy. And in English, basically what that means is shockwave is a therapeutic device that we use. And the way I explain it to my patients is everyone knows what an ultrasound is. The ultrasound is a sound wave that goes into the joint and then comes back, and we get a pretty picture of that joint. And then everyone knows what lithotripsy is, which is a sound wave they use to break up rocks, right? So there are kidney stones, excuse me. So that's the extreme. So on this side of the extreme, we have ultrasound. On this side of the extreme, we have lithotripsy. Right in the middle of that is shockwave therapy, which creates micro trauma inside of the joints and basically tricks the joint into healing itself. Okay? So we use that, and then we use laser, which is basically a way of using light to stimulate those cells to produce more energy so they heal quicker. We use both of those on both of his shoulders, and my thought process that whole time was this is going to get him some pain relief until we can actually get a needle in him and do this injection. But I was wrong. With one visit of shockwave and laser, we completely restored his range of motion in his shoulders, got him completely pain-free, and a very, very happy individual, and continuing on with that excellent quality of life without having to cut on him, without even having to put a needle in him. So that's my story for today.
Okay. Well, it's the first thing that you said right out of the gate, Brady, that is so true, is that this patient wasn't going to take no for an answer. There had to be somebody that was available that can actually help him. And again, you really have, two types of people. One is they're just sheep, and they're going to do what they're told. And you and I can't help those people. Really, nobody can help those people, because their life is not their problem. It's not their responsibility. They're going to dump their life and their health problem on the doctor, and the patient is going to take zero responsibility for their life and their health. And those people just don't last long in here. And again, this, just like in your case, my case, in my office, this is a partnership. Okay, I can't be the one that's going to toe the line for you. And so I'll give you an example of one of my patients, and this is an amazing case. He came in for a frozen shoulder and knee problems and just a lot of different health issues. His wife, and she's in my book, and she's done a 5-minute. She even went on TV and did a 5-minute testimonial for me on TV. And it's crazy. It's crazy. But here's the reason why. They're in their 70s, and she takes her husband into the doctor's office in a wheelchair. And the doctor says, nothing can be done. You need to put him in an assisted living, and basically y'all just go on with your life. And she's like, no, there's got to be someone that can help this man. So she found me. I can't remember if she found me online. I can't remember how she found me, but nevertheless, she found me. And fast forward with our medical director recommended exosomes for him. And we did Trigenics, which is a neurological treatment system that we use for frozen shoulders and knees, Shockwave, just like you were talking about, and laser therapy. And now, I mean, fast forward 9 months from when this man came into the clinic in a wheelchair. They went to Israel for 2 weeks, and then they went to Yellowstone. And again, this is a person that if he had been a sheep and said nothing can be done, they would just, got in the fetal position and said, well, my doctor said nothing can be done, and he knows what he's talking about. Right. And can I say this? If a person goes to a specialist, that just, specialists solve problems. Okay. Right. If you see here, I got a bunch of letters after my name, but if I can't solve a problem, all that means is I know how to take a test and pass the state board. And I see that, you're right. I mean, I see that a lot with, I've been going to this specialist for 2 years. Well, have you gotten better, stayed the same, or gotten worse? Nope, I'm worse. Well, okay, then we've got to look at something else. And so it's, your medical, let me just back up and say this. People who take insurance with these chronic health problems are probably never, ever going to be able to move you past where you are, because they don't work for you. They work for your insurance company. You're just a breathing organism who has a card in which you come in and this person gets paid to see you. And go ahead.
The ultimate goal with that card and that number, that the ultimate goal there is what's the bare minimum that we can pay so that we can still make a profit off of the premium that you're paying every month.
Absolutely. And so it's, at some point people have to, and this is why in my book, this is why, like on one of the very first pages I talk about, is if you want to get well, you are going to have to take responsibility for your life, for your brain, for 100%. Your everything, because it's our healthcare system is not designed to help chronic health pain patients. And it's just amazing to me. I just had a lady that brought her son in. He's 40. I know this is another war story, but probably should have saved this to next week. But sometimes I get started and I can't stop. But she's a nurse practitioner. Okay, her son comes into the clinic. He's 40 years old. She pushes him in a wheelchair. He's got neuropathy, metabolic disorders, autoimmune disorders, and he has GERD. And then I was like, okay, we probably have an autoimmune disorder. And she said, I told my medical doctors that he had an autoimmune disorder and nobody would listen to me.
Right.
And I'm like, and I'm like, well, you're a nurse practitioner. There's you can order these tests, so, but it just blows my mind that, okay. And again, like you were saying, he had neuropathy. He was on gabapentin, and the first thing I asked her is, why is he on gabapentin for neuropathy? Because this is an anti-seizure medication, and what this does is actually slowing his brain function down. It doesn't cure anything. It slows a person's brain function down so they can't feel their body. And since they can't feel their body, they're like, oh man, I'm cured. It's like, well, not actually. You're losing neurons and you're killing your brain, and that's why you can't feel your body. So
and it does absolutely nothing for the blood flow, which is the root of that problem anyway.
So those are, my, and one of the things too, when this patient comes in, every time he comes in, and I have new patients that start up on the same day he comes in, I'm like, this guy was in a wheelchair. Oh, and by the way, the guy that, let me back up about the guy that was in the wheelchair and told his wife to go to the nursing home. It's like, look, watch him when he gets up, from oxygen therapy or the PMF or whatever, and watch him walk. And you tell me that this man was, in a wheelchair, and his doctor, the only advice he gave him was assisted living. Now, the gentleman that came in with neuropathy, his mom, that's a nurse practitioner, pushed him into the clinic. Right now, he is gone from a wheelchair, and it's been 2 weeks. He's gone from a wheelchair to a 4-prong walker in 2 weeks. Okay. So again, it's not like it takes forever in some situations to get these results. We're just barely into the program now. And so it's just amazing when you go to the right doctor who has the right skill set, you can change people's lives. And so that's, and you see this every day. I see it every day. And, but again, patients have to take responsibility for their own health.
It's 100% true. All we are is your partner. That's it.
Yep, that's it. Because I'm not going to take. I've got enough. I got enough to deal with taking responsibility for Andy Barlow. I don't have time to take responsibility for another, grown human being with their life. And again, it's like you and I talked about last week. We are, and I think I talked about it with you, is human beings are only on this earth for a short period of time.
Right.
And it truly blows my mind, Brady, when I see people that have they have these chronic health problems for 20 years and they're just okay with it, or 20 days or 20 minutes or
it's
2
like
days.
They've been given that label, right? That I've got condition XYZ, therefore nothing can be done. This is me accepting my reality. That's bull crap.
And here's my thing that I tell patients all the time. It's like, what kind of legacy are you going to leave for your grandkids?
Right.
Well, how are they going to remember you? And I don't want to spend one day of my life, if I don't have to, in pain or with a balance disorder or vertigo or whatever. Matter of fact, when we get finished here, I'm going to play an hour and a half of racquetball, and life is about doing the things that you want to do. And it's like, it just seems to me that as Americans, sometimes all we are is just whiny little children.
Right.
About, I've got this pain. Nobody can help me. No, you're not looking for people to help you. There are people here that can change your life. I've got people that come into my clinic from two different countries and 15 different states that come in here to get their life changed. You know why? Because they wouldn't accept the fact that their doctor said nothing could be done. And I tell you, if I tell you nothing can be done, you are in serious trouble, because we're going to be looking at everything from brain to metabolic to autoimmune to inflammation. And again, it's all of these mechanisms that have to be addressed. And please, anybody listening, just if you have a chronic health problem, just stop even thinking that there's going to be one thing that you're going to do that's going to solve this, because it's not going to be one thing. It's going to be multiple things that we're going to have to do together to help you solve this issue.
The longer I practice, the more things that I see happen, the more I experience life. I think the number one recommendation that I would give for people that with a health problem is actually just turn off the freaking TV.
Yeah, that's true, man.
I believe you call it the stupid box.
Yeah,
but it's
the more you watch, the stupid you get. The more stupid you get.
Start. Second would be diet, and that's we can dive into that another day. But I'm sure you cover that in your book. Like I said, I won't get it until later this week. Which I want a signed copy, by the way.
You'll get one. I'll get you one.
All right, Andy, I think we should let's wrap it up for this video, and we'll just keep doing these war stories every week.
And two, I mean, again, it's important for patients and people who may be listening to this. You and I know doctors all over the country, okay? And even though somebody might not be in Idaho or Mississippi, it doesn't matter, because I had a patient coming in from Minneapolis last week, and I'm like, look, I have a network of doctors that I've trained throughout the United States, and I can help you get the care that you need, but you have to want the care. You have to make that commitment. And here's the thing I'd like to wrap up, to solve any problem. If you have a problem that money can solve, you don't have a problem. It's 100%. The problem that money can't solve is when you have a problem. And then secondly, when you have a problem, it's going to require time, energy, and money to get this problem solved. I don't care. I mean, if somebody, God forbid, right now, one of my patients accidentally ran into the wall in my office, there's a problem, and it's going to take time, energy, and money to solve that problem. Chronic health issues are no different. Okay. Hey, Brady, I appreciate you, man.
Yeah,
love you, and
always, man. Love you too, brother.
Look forward to seeing you next week.